Hi, this is an afternoon vlog. I'm home alone for a little while longer. I just got home. Um, Paul took Cody and Poppy to the Little Acorns outing. I don't know if I mentioned that Poppy's back in Little Acorns, which meets every Wednesday. They had an outing in Quogue, which is out east. It's a wildlife refuge. And I couldn't go because I had yet another cardiology appointment. I think this is my third. And the news is not so good, and I'm kind of in shock. Um, Today, the test was they hooked up a million different tapes, and in fact, they forgot to take one off. Wait, that's my boob. Oh, here it is. Lots of these things. For some reason, I want to keep it on and show Paul. A lot of those. And they had me walk on a treadmill at higher and higher speeds and incline. And then when I couldn't take it anymore, they had me jump off. They didn't even turn the treadmill off. And then they did um, um, like a sonogram or ultrasound of my heart. Um, and they also did an ultrasound before I got on the treadmill, so to have like a resting heart rate and then active heart rate. And while I was on the treadmill, they were monitoring my heart rate and taking my blood pressure like every minute. And it was stressful. There's a lot of delays. I was waiting for a cardiologist. It kind of took forever. I was there for 2 hours with like all these things taped to me in like a little paper gown, and it was kind of boring and stressful. And then the test itself is kind of stressful. It's a stress test. So anyway, when I finished it, the cardiologist said, "Well, you need to have a follow-up appointment with Dr. Roboto because the lower part of your heart is not." He was scary. He was like, this was, what was it, irregular? Oh, I can't remember the words he used, but he pointed to the treadmill machine, heart machine that was attached to the treadmill, and he was like, oh yeah, he goes, that was abnormal, because I've had a whole bunch of, I've had another stress test, and I've had EKGs, and they all keep showing that I have an irregular heartbeat, which is an arrhythmia. So he's like, that this is abnormal. He's like, well, now we know that this is abnormal. And he referred to the sonogram machine, whatever the fuck that's called. And he said, he's like, the lower part of your heart is not functioning well after exercise. And you're going to have to talk to Dr. Roboto. I don't know why Dr. Roboto, this guy's a doctor, but anyway, about treatment options. So it's just scary. So of course after the exam, after that, I went to Starbucks. I couldn't have coffee for 6 hours before this test, so I had a pounding headache. This is my first coffee of the day. I go to Starbucks while I'm waiting for my coffee, and I had a sandwich there. I Googled literally what he said: lower part of heart not working after stress echocardiogram, and I guess I'm at risk for stroke and heart failure. The lower part of the heart is also known as the ventricles. So my ventricles aren't functioning properly. And it's really scary. I'm really scared. Um, and the weird thing is that for many years now, I have had occasional heart palpitations. It's like a fluttering, and usually at rest, not during or after exercise or activity. Um, but I never really questioned it. It wasn't something that bothered me, and it was only occasional. But the past month, it's been increasing a lot. Like a couple of weeks ago, I was on a date with Paul, and it just kept happening in waves over and over again. Not painful, but it was disturbing, especially now that I've been undergoing heart tests. Like, I'm so aware of it now. But it's also unusual, and I wasn't like having some kind of panic attack or a stressful scenario. Nothing was going on that could have obviously triggered it. And if, oh, they're home. Okay, well that's it. And I don't know. what's gonna happen. This is, I don't wanna keep doing it, they just got home.